Jefferson Health, one of Philadelphia's biggest health networks, is laying off hundreds of employees, citing major financial issues.
So on the news yesterday, Jefferson Hospital came out with an announcement. The whole healthcare system, they have about 5 or 6 hospitals that they are laying off between 600 to 700 healthcare workers.
Wasn't nursing supposed to be one of the recession-proof professions? No matter what, people are going to need nurses. Why are they laying off 600 to 700 nurses? Well, I know why. It's because the big beautiful bill is kicking in now. All these Medicare cuts, Medicaid cuts, they are impacting all these healthcare facilities. They will never warn you that they're going to close. It's up to you to figure this out. You're supposed to understand that once the federal government starts to make cuts at the top, this will impact your job if you're a caregiver, if you're a nurse. So instead of waiting until they make these massive layoffs, you need to start getting ahead of the game, guys. If most of these hospitals are depending on Medicare, and by the way, all these hospitals, 90% of the patients are all Medicare, Medicaid, and they're overcharging the government anyway. This is why the Republicans are trying to make these cuts, because they know there are a bunch of hospitals like these ones that is overcharging the government for the services. A treatment that's supposed to be, let's say, $2,000, they're charging $20,000. It's outrageous.
There is no specific detail at this time as to which kind of workers those are. They say it makes up about 1% of the workforce. But here is a fun statistic that I actually, of course, I do my research. Do you know the CEO, Dr. Joseph Cacchione, made his salary was $5.38 million as of 2023. That was his.
Yeah, he's cashing out. And he's probably made more in 2026.
Yearly salary. I'm not saying this gentleman doesn't work hard, okay? But I'm looking at what I make and what I...
No, he doesn't work hard. He works smart. He did the math. He saw what happened with the big, beautiful bill. He did his calculations. He's like, okay, It's like, damn, the government is going to cut Medicare. That means this hospital is not going to make any money. Let me just get rid of all these people, all these minions, and then cash out and, retire early. This guy is probably retiring somewhere in Thailand, 2 or 3 girlfriends in Thailand, 1 in Mexico probably, chilling. These guys are cold. These guys are ruthless, guys. They don't care about you like that. You have to care about you.
I know a lot of my friends that work for Jefferson in similar healthcare fields, and we're the ones doing the care and bringing in the revenue and charging for services to healthcare providers. Those CEOs don't have the blood, sweat, and tears that we are seeing every day, and we're working our asses off, and nothing.
Yes, you as the caregivers, you're the ones that are doing all the labor. You guys are now the wage slaves, and that guy is just at the top. He's the puppet master. He sees the bigger picture. He knows, okay, the federal government is not going to pay us anymore over here. And I got all these people that are depending on me. They need salaries. Instead of me telling them what's really going on, I'm just going to cut them off and then bounce. Take my money and bounce. This is capitalism, guys. Nobody cares about you. Nobody.
Thing that we make is reflecting cost of living increases, okay? The fact that most of my friends can't even pay rent or buy a house. Okay, so what's wrong with this picture? They have reported, according to this article, a $1.95 million loss as of June 30th. That was the end of their fiscal year of 2025. And the CEO's salary is $5.38 million as of 2023. What's happening? What's going on here? Where's the disconnect? I mean, we all know healthcare is for profit, and that's where the biggest problem is. I've been seeing, the care go downhill.
Jefferson literally saved my mom's life 21 years ago. They will forever have my respect. I'm sorry to hear this. The doctors, the nurses, and staff at Jefferson saved her life. They deserve the respect, not the company. I was a Jefferson nurse. They treat all their staff like dogs. Awful organization to work for. Temple is no better. I thought healthcare was one of those only sectors doing well. This is scary stuff. Just lost my boss today. She was one of the best I ever had. Can't believe how they did this. I'm sorry to hear this. It really sucks when great people get caught up in this, and I'm sure that the work will suffer as a result. Yes, it really does.
And what ends up happening in these facilities is that as things get worse and worse, the best people start leaving first. They can figure out what's really going on, so they leave. And then the ones that stay, that remain because they're desperate for a job, they get treated like crap.
We had no clue it was going to happen until they sent out a simple email. I am beyond stressed, unsure if more will be affected, and we were just bought by Jefferson. A lot of their staff still have no idea how to run our systems. I kid you not, I was just about to make a vehicle purchase after many years of driving my old 2001 Honda. I got a cashier's check for a deposit, and after getting the email regarding layoffs today, I am stunned and about to go get a refund on my cashier's check. Prayers for all of those who lost their jobs today. The way they are going about it is an absolute bullcrap too. Disrespectful.
Okay, I'm not gonna react to the entire video, but you guys get the picture. It's sad. This is a sad reality, guys. You gotta look out for yourself, because at the end of the day, if you stay in a facility like this one, you know things are not working anymore. You understand the big beautiful bill is in effect. The government is making major cuts. That means it's going to have a ripple effect on you. If you're working for a major hospital, major care facility, it's going to come for you. It means that you need to start making moves now before it's too late, or else you're going to continue to be treated worse and worse and worse. Eventually, you're going to be no different from a slave. Some people already are wage slaves. They don't even know they're wage slaves. We're going back to the 1600s, where people like this, that look like this, were real slaves. At least those ones, at least they had a place to stay, they had food. The new types of slaves are going to be sleeping in their cars. You won't have anything to eat. At least the slaves back in the day, they were given 3 square meals. Let's hear what this one has got to say.
Are now hearing from staff members about recently announced department closures and layoffs at Pottstown Hospital.
A representative for Tower Health confirms to CBS News 131 positions will be eliminated within 60 days as the hospital closes the intensive care unit. And
see how depressed these people are? They look so depressed. Instead of you doing this, don't do this, guys. Don't even bother, because it's not going to change a damn thing. Don't be. You see this lady right here? You see she's crying. Listen, I feel bad. I feel bad for her. Look at her. She's crying. What I'm telling you guys is this. This is time that you need to pivot. If you're in Pennsylvania right now, you need to start thinking differently. How do you pivot out of this? How do you get out of this mess? I can teach you how. You need to start investing in yourself. You need to learn sales skills. You need to start switching from working for a care facility to branding your home care agency yourself and delivering these services to the private marketplace and charging private pay. Because just because you're getting laid off or you're about to get laid off, like a lot of these people, does not mean there's not going to be a need for your services. In fact, if you're a nurse right now, if you're a registered nurse, you're in demand still. You just got to switch the way you think about this new market. We're in 2026. We're not in 2024. This is the Trump economy, not the Biden economy. It's a third world economy now, guys. The United States is now a third world country. So I can teach you how to get private paying clients, and you need a coach. Schedule a call. Don't waste your time protesting like these people. These people are wasting time. If you're in Pennsylvania, I wish these people would just learn new skills, like sales skills. I'll put a link in the description of this video if you're in Pennsylvania. If you schedule a call, I'll add you to a private WhatsApp group so we can all collaborate. Because you need a coach and you need a community of other people in your state that are going through this so we can help each other to start getting private paying clients and get some of this work. Get ahead of the game before everybody else catches up. Schedule a call. Talk to you soon.